Let's talk about this medication that is almost never discussed as an individual medication because it's most commonly associated with the auto-injector that contains atropine. This medication is called Pralidoxime chloride, and its brand name is Protopam. We administer this medication to patients who have experienced organophosphate poisonings or nerve agent exposures. Here's a nifty little mnemonic to help you remember the signs and symptoms of nerve agent exposure. Sludge them. So if your patient is drooling, they have tears coming out of their eyes, they're urinating, they have incontinence, GI upset, they are vomiting, and they have meiosis, which is constriction of the pupils, chances are your patient has been exposed to organophosphates or some type of nerve agent. Pralidoxime falls under the class of cholinesterase reactivators and antidotes, and in order to understand how it works, we have to know what cholinesterase is first. It is an enzyme that is essential for the human nervous system, and it basically keeps this neurotransmitter that we all have called acetylcholine in check. So one thing is when our patients are exposed to organophosphates or to nerve agents, acetylcholine gets out of check. You just get too much built up in the human body at the neuromuscular junctions. So what pralidoxime does is it goes in and destroys the accumulated acetylcholine, and it allows for the reversal of respiratory paralysis, which our patients can experience when they are having organophosphate poisonings, and also the muscular paralysis. What are some contraindications, or when would we not administer it? So if it is indicated, meaning if you have an adult patient who is experiencing organophosphate poisoning or some type of nerve agent exposure, administer pralidoxime in conjunction with atropine via the duodose autoinjector or the Mark 1 kit autoinjector. However, if you have a pediatric patient, it is not recommended. Some adverse reactions you could see with pralidoxime are drowsiness, headache, nausea and vomiting, and extreme cases, seizures. As for drug interactions, you want to avoid the administration of succinylcholine when you've administered pralidoxime. As I mentioned earlier, the duodose and the Mark 1 kit both contain pralidoxime and atropine. So the dose for pralidoxime is going to be predetermined. It's 600 milligrams in both of these autoinjectors, and it's given via an intramuscular injection. And I did, just as a side note, want to talk a little bit about the Mark 1 kit and the duodose kit. So the Mark 1 kit has atropine and pralidoxime, but they're two separate autoinjectors. Whereas the duodose has two separate medications, but it has one injector, and it just goes into different areas of the skin. One side note I wanted to add in there is that sometimes I see my students get cyanokit and this medication mixed up. Cyanokit is specifically for cyanide poisoning or smoke inhalation, whereas pralidoxime and atropine are meant for organophosphate poisoning and nerve agent exposure.